that all the information shared today will be recorded. We'll send out a video recording. It will be a link as well as a PDF of all the slides. We want you to take notes and use the chat function or the Q&A function if you have questions. Also, if there's something that you're just really not certain about, our first disclaimer is that you should contact your primary care doctor. That's your first line of defense. Always, always reach out to your healthcare provider. We're still in a pandemic. We've been hosting these weekly sessions every Tuesday at 2 p.m. since March 31st. So thank you all for joining us every week. We appreciate you for being here with us. Welcome, and John's gonna take us away with some exercise, because what do we say every week? What's good for your heart is good for your brain. So we wanna get you pumping, we wanna get your oxygen flowing, we wanna get all those pathways connected and ready for you to tune in and listen to all the great information. So John, if you're ready, come on in and get our hearts going.
Hey.
Hi there.
Hey, how you doing? Hey, how you doing? I want to welcome everybody to the Emory Alzheimer's Disease Research Center. And remember, what's good for your heart is good for your brain. Today, if you have a stick, a chair, a broom, a cane, I need it right now. In 3 seconds, if you can go get that, and we're going to get started. And if you don't have it, don't worry about it. Remember, you need a comfortable chair, sturdy chair, before you get started. So 5, 4, 3, 2, and 1. Okay. We got our little vibe going. Come on. There we go. Can we go on a little walk? If you don't want to stand, you don't have to. And you just walk with me in that chair. But if you want to stand, come on. We're going on a little walk. Come on. There we go. Keep stepping. Keep stepping. Come on. Sit down a little bit. Come on. Sit down a little bit. Come on. Water. Let's sit back down. Hey. There we go. Break it down. I need y'all to roll with it. Come on. There we go. Press. Let's go up in angle. Angle. Woo! Come on. Can I get a little bit of that back? And them shoulders. Those ribs there. Let's go. Can I get some of that? Twist. Hey. Come on. Come on. Come on. Come on. Other leg. Let's go. Woo. Come on. Come on. Right. Other side. Let's go. Great job. Great job. Woo. Let's take the tempo up a little bit. I need them feet tapping. Come on. We're going to create that circulation now. Come on, we loosening that body up from sitting down too much. We got to get some of that COVID weight off. We got to get some of that COVID weight off. Let's go. Just hold that. Hold it. Just hold it up. We're in an isometric position. The abs engaged. That hip engaged. Let's switch legs. There we go. I'm feeling good today. Great job. Great job. I'm going to turn the music off because I want you to really engage. I want your arms up, and then I want you to come in and squeeze. Breathe and out. Arms here. We're going to cross over and go over and stretch those lats. We're still creating blood flow, but we get a nice stretch in. Right now, your body's saying, what are you doing? What are you doing? And so the blood is protecting itself. Lock your hands in, turn, and push. Let's go in and out. Great job. Can we grab that knee? Even if you got to pull on your pants, grab that knee and squeeze. Your back is straight. Let's just straighten the leg straight out and lift up. Great job. Other leg. Bend, pull, back straight. Let's straighten it out and let's go up. Great job. Okay, butterfly. I want you in a butterfly position, and we're going to stretch those outer hips, but also stretch that lower back. Let's turn a little bit so we can isolate one side of the back. Any sciatic nerve, we can just release the nerves and just let it flow. Okay, feet wide, and we're gonna go left to right. Left, good. Right, left, and right. Can we just grab the back of the chair? Grab the back of the chair, and I want you to get upright. Then I want you to arch like a cat. Go upright, arch like a cat, sit up straight, and arch like a cat. Great jobs. Can I get these fingers for any kabatana? I need you to just work those fingers, work them. Let's get the wrists. I want to go in and out. And let's work on that rotator cuff. Rotate it, rotate it, rotate it. Then the other arm, rotate it, rotate it, rotate it. Let's do both arms going backwards. Rotate it, and rotate it. On the waistline, I just want you to go left, right. We're just manipulating the spine to get it back straight. Now straighten it up and sit up straight. Inhale, exhale. Inhale, exhale. I want to say to everyone out there, enjoy life. Do something for your body every day. Remember, what's good for your heart is good for your brain, and it's going to circulate. And remember, tell family members and friends what Emory Hospital is doing, not only for you, but they need the information as well. I'm John Lewis, and see you later. Bye.
Woo! Thank you, John. Thank you, everyone. Welcome. Today, we have a great lineup for you again, as always. You're going to hear from Dr. Ken Hepburn. He is our Outreach Recruitment and Education Core. He's going to be talking about teleworking and care recipient management. So if you are a caregiver and you've been teleworking or telecommuting during the pandemic or during the stay-at-home orders, you're going to get some great tips from Dr. Hepburn today. Then you're going to hear from Dr. Monica Parker. She's going to be talking about adult vaccines. We've been hearing a lot about the upcoming, what's going to come online for the COVID vaccine, but there are some vaccines that you need to be aware of as an aging adult. So she's going to talk us through that. And then you're going to hear from one of Dr. Madeleine Hackney's team members. She has a research study that has come online, and she's going to give you some information about that. Remember, we are a research center. Our ultimate goal is to find a cure for research. And in order for us to make that happen, we have to be actively engaged in the research environment. Then finally, you're going to hear from Maureen Burke. She's the occupational therapist for our cognitive empowerment program with the Emory Alzheimer's Disease Research Center. So she's going to be giving you bathroom safety tips. So lots of great information today. And then we're going to close out with Whit. Every week, we're talking about our healthy aging study. It's an online study that you can participate in from the comfort of your home. It takes about 20 plus minutes for you to participate. If you're already a healthy aging participant, we really appreciate your engagement. So with that, I'm going to turn it over to Dr. Hepburn. Thank you. Hello, Ken.
Hi, Cornelia. How are you?
I am well. Give
Good.
me just a minute. If you want to introduce your topic, I'm going to bring up your slides.
So every week I open the envelope and Cornelia has assigned me an intriguing topic. This week is near and dear to my heart and has to do with teleworking, which is what it feels like I've been doing now, or all of us have been doing for 6 or 7 months. But teleworking and care recipient management. So you're in a situation where you have a responsibility for a person living with a dementia, and you're also working. You're working from home. So let's talk about that. If we go to the next slide. So as always, I think it's really important, don't just do something, stand there. Step back, look at the situation. You are facing, just by virtue of the pandemic and all the restrictions, longer days of caregiving. Whether you're living with the person or not, there's still longer days of caregiving. Both you and the person who's living with the dementia are experiencing a greater sense of isolation. So just right there, there's intense pressures. And then if you're teleworking, we've all figured out by now how taxing being on Zoom for hours and hours a day can be. So a third pressure. And the other thing that maybe we don't remember is how much social stimulation and support and intellectual stimulation we get from being in work, just having those conversations in the hallway. So lots happening, and we need to acknowledge that. And I want to just start out this presentation, and practically everyone I give, just giving absolution to one another for all of the corners we have to cut and all the ways we think we're failing because we're not. So compromises are called for, and they're very much in order. So next slide, please. So I want to say that in this time, if you're teleworking and caregiving, you have to switch your role a little bit from guidance, which I really think of as the full caregiving role that really takes the person so intensely into account, from guidance to management, where you've got a situation that you have to manage. So optimally, you're really being very attentive to a person's ADL care, just through all the normal things of getting up and getting dressed and eating and toilet and everything. And very carefully attentive to choosing and designing activities during the day that are designed to promote the fullest kind of engagement. The person is really there and present and tied in, and also providing variety in the day itself, but across the days of the week. And overall, just ensuring that days are as calm, safe, and pleasant as possible. But you got to switch a little bit from that really holistic view of caregiving to a bit more functional view, where maybe there's some slippage in ADL care. So the person's wearing the same sweatshirt 3-4 days in a row. Maybe there hasn't been a shower for a couple of days. Go with it. Probably there are more highs and lows. There may be more little outbursts. There may be more kinds of withdrawals. The person is bored. And so more diversions are called for. And so what I think you have to do is develop a whole bunch of go-to activities, just little things you can flip a switch in some way. And so the person will become reliably involved. They don't have to be, terribly creative. They can be repetitious. There can be less variety. So if this person likes to watch that particular segment of some old TV show that you've got on YouTube, instead of watching it Tuesdays and Thursdays, watch it every day. Or instead of watching it every day, watch it twice a day. The person, you can kind of rely on the dementia to allow the person to be experiencing it for the first time. You may feel a little creepy. Oh gosh, I'm turning this on again. But for the person, it's relatively new, and if it's engaging, it's fine. Next slide. So, there are two possible scenarios here. Either you're living with the person or you're a distance caregiver. In either case, you're teleworking. So next slide. So if you are, next slide, please. If you're a distance caregiver, you already got some pre-pandemic arrangements in place, right? You've probably got some sort of home care coming into the home. You're maybe able to be checking, if you're living in town, checking in on a regular basis. Perhaps there are visitors coming in. There have been visitors coming in. Maybe one's church group has organized some people to be coming in, or a civic group, or just groups of friends. And maybe there's an occasional or regular adult daycare. So now you got to revise those arrangements. You still can have home health care, but you've got to have appropriate precautions in place. You really have to have some sort of protocol established that you can check on a very regular basis that that home care person coming in doesn't have a fever, doesn't have symptoms, hasn't been exposed, is not likely to bring COVID into the home. Now, you too are external to the environment. So if you come into the environment, same deal. Have you got a fever? Have you had symptoms? Have you been exposed to other people with the virus? So you now have to apply these to yourself. You might let some visitors come in, probably a smaller number and with the same precautions. And there's no adult daycare option. Really, it's off the table. So at home, bringing people in, including yourself, with lots of precautions. Next. You got to strengthen the home care's ability to provide activities. So share that go-to toolkit with them, give them permission. Yeah, let her watch the TV show twice a day, 3 times a day. It's really okay. If you're going to visit, maybe have to be longer so that you can, take a little pressure off the home care group. This is going to put more strain on you. And again, carefully expand the pod. Next slide. So if you're living with the person and teleworking, you're home more physically, but you don't have more additional time for caregiving. It's just that you might have a little bit because you're not commuting, but it's just as if you were heading off to work. You probably had home help coming in, and but now that you're home, you're an unavoidable presence, and it's going to create a demand for attention. And I'm not even going to talk about homeschooling. If you're teleworking, caregiving, and homeschooling, that's probably takes an hour. But for now, we'll just talk about this. Next slide. So the adjustments, you have to assume that some home care arrangements are in place. negotiate with the home care person how to incorporate your presence, but also how to ignore it. So maybe set up times when the home care person can rely on you. Maybe you go to lunch with the person, maybe you have a snack with the person. Otherwise, you're out of the room, you're not there. Organize your telework to enable some caregiving. I mean, that's one thing about telework. It does enable some flexibility. And you might use yourself to help the home care person get involved in a go-to activity. So in other words, you can be an aid to the home care person in urging your person, oh, why don't you go watch that show? You can still expand the pod even though you're at home, act as though you're not. Still can have a visitor or another family member with precautions coming in. All of this, really extra attention to your self-care. You've got longer caregiving days. You've got Zoom life, which is getting worse and worse. So you have a double whammy on you. Don't avoid it. Don't avoid acknowledging that. I think that's what I've got. Maybe there's another slide. No. There. Thank you.
Okay, thank you, Ken. So not to downplay the self-care piece, but what are one or two things that people can do immediately for self-care? If they're teleworking, they're Zooming, they're homeschooling, they're the janitor,
Yeah.
the nurse.
So I would say one thing to do is if you can have scheduled meetings where you don't have to be present visually or sound. So if you're going to a meeting and somebody's just going to be talking or something, turn off your video, turn off your sound, and do something. Do a John Lewis kind of thing. I mean, honestly, I have some weights around my desk that I do some weight work when I have that kind of meeting. So think, is there something I can do? I can pay attention, but I can be doing something for myself. And I think the other thing is to actually ensure that do you really need an hour-long meeting? Can you do it by phone instead of Zoom? Because a phone call will take you 20 minutes and the Zoom meeting, it just consumes an hour. It's like a law of nature somehow. So those are two tips.
Thank you. With the exception of our Zoom meeting. So
Our Zoom, no one should turn off the sound or video. That's right.
Yes, yes. All right. Okay. So thank you so much, Dr. Hepburn. Again, these slides will be available in the coming days, and he will be on if you want to chat. Next up, Dr. Parker, you're going to be talking about vaccines. What do older adults need to know?
Well, I think the important thing that everybody should take home today is that there are certainly 2 vaccines that I want anybody on this call to be sure that they have. And as we go through the talk, we'll find out about it. I just want you to understand that vaccine research is ongoing for COVID-19. As of this moment, we have several vaccines that are in development. And if you have been fortunate enough to find a vaccine trial to participate in, please participate, because we need everybody to participate to make sure that whatever vaccine is developed is as effective for women as it is for men, as effective for people of color as for people who are not persons of color. So what happens with COVID-19 and the upcoming vaccine, I can't begin to tell you because we don't know yet. That's all. We don't know yet. It's not available yet, so don't even talk about it yet. But right this moment, there are several vaccines that are available that we should take that have been proven to be efficacious in all groups of people and have been shown to prevent disease and morbidity. Morbidity is death. So I will say that right now we're entering the fall, soon to be winter seasons, and the opportunistic infections, the pneumonias and the influenzas are the things that can spell significant sickness for older adults and do result in quite a few deaths. Okay, maybe not 200,000 in 6-month period of time, but they do result in significant hospitalizations for older adults. So what are the vaccines that you need as an adult? All adults need, number one, the influenza vaccine every year. That's something you get every year. All adults do need to have a booster pneumonia vaccine, Pneumovax. And all adults also need to have the tetanus or Tdap. I mean, I've adjusted these slides a little bit. And then finally, the shingles. So let me recap that. All vaccines that adults 65 plus need. Number one, influenza vaccine every year, a booster dose of pneumonia vaccine, the tetanus, Tdap vaccine, shingles vaccine. There may be other vaccines that you require if you travel outside of the country, if you have specific kinds of health conditions, and or do something different for your job. Okay, if you're going to the continent of Africa, you may require a typhoid vaccine. But if you live in the United States of America, you probably don't need that particular vaccine. But all adults need influenza, a tetanus or Tdap vaccine, pneumonia vaccine, and a shingles vaccine. Those are 4: influenza, Tdap, Pneumovax, and shingles. Next, please. So I just went through that. Keep going. Now, pneumococcal vaccine, which one should you get? All adults 65 years of age and older should get the conjugate vaccine. We call it the Pneumovax 13. I don't know what's happening there. PCV 13. You get that one first, and then if you are an adult who has other problems, if you're a smoker, you need to get the PPSV 23. Okay, why? Okay, each vaccine protects you against certain strains of Streptococcus. PCV 13 is 13 strains of Streptococcus. PPSV 23 is for 23 different strains of vaccine of strep, pneumococcus infection, okay? PCV 13 is first. 1 year later, you get the PPSV 23, okay? PCV 13 first, and if you're a smoker, you need to come back a year later and get the PPSV 23. In any event, you talk to your doctor, your primary care doctor, about which ones you should have. If you can't remember whether you've got one, the one you need to get is the PCV 13. Next slide, please. Shingles. Now, why do we need the shingles vaccine? Okay, it's for adults age 50 and older, including adults who have had shingles or had previous shingles vaccines. Okay, the most important piece is that if you have had chickenpox when you were a child, chances are when you get a little older, over the age of 65, chickenpox comes back, only instead of going all over your body, it's just in one nerve, and it's wherever that nerve has distribution. Shingles can be incredibly painful and can be incredibly debilitating. One of the syndromes that goes along with shingles is something called post-herpetic neuralgia. It's kind of like a numbing, chronic stinging kind of pain that you get wherever those zoster sores were. And even if you get the vaccine, you may develop a mild case of shingles, but it won't be as debilitating. You're less likely to develop the post-herpetic neuralgia, which is a chronic pain syndrome, which can last for weeks, months, even years. So which one do you get? The most common one, the one that you're supposed to get. Somebody can't hear me? I'm not exactly sure. I see me.
I hear you loud and clear.
Okay. The first shingles vaccine that you really should get, because Zostavax is going to soon not be available after November of 2020, is the one we call Shingrix, Shingrix, not Zostavax, but it's shingles. So again, shingles vaccine for those of us 65 years and older is to keep us from developing the painful sequelae or painful outcomes of having the recurrence of the chickenpox virus recurring in a nerve. You get 2 doses. usually 2 to 6 months apart. Last year, they didn't have the second vaccine for me. If you're 50 and above, you need 2 shots of the shingles vaccine. And the going vaccine, or the one that's most prominent, the one that's most commonly given in the United States, is called Shingrix. If you had Zostavax before, check with your provider and see if you don't need a Shingrix vaccine. Next. Okay. There's one called the human papillomavirus. Now, fortunately for most of us on this call, we've passed this particular mark, but the human papillomavirus is the virus that's associated with cervical cancer. It's associated with head and neck cancer, and it's associated with several other kinds of cancer, usually regarded as sexually transmitted. But if you are grandparents and you have children in your house that are age 12 to 18, up until the age of 26, we can get these immunizations. Again, it's a one-time series of 2 to 3 vaccines recommended for persons 26 years of age or younger. Most children who are in middle school are getting this particular immunization. Now, why is this important? Again, human papillomavirus has been studied and found to be associated with the development of cervical cancer, but also head and neck cancer. And this can be debilitating for you, particularly if you had developed advanced cervical cancer. People with pap smears now are not as likely to develop a significant, not likely to die from cervical cancer because we're getting it treated, catching it soon enough and curing it. But for our grandchildren who are 26 years of age and younger, we do advocate that you get the human papillomavirus, not for those of us who are 50 and above, but for those 26 years of age and younger. Next slide, please. Measles, mumps, and rubella, who gets this? Adults in the United States who were born in 1957 or later and haven't received the measles, mumps, and rubella vaccine really need to get this. If you are a woman of childbearing age, chances are your gynecologist has checked you for this and advised you to get a measles, mumps, and rubella vaccine if you are not immune. For most babies, most children up until the age of about 2 have received a measles, mumps, and rubella vaccine. They've gotten bonus doses again when they're in middle school, but when you become a parent or think about becoming a parent, one of the titers that they will check is your measles, mumps, and rubella to make sure that you are immune. They'll check your titers, but they're re-immunizing college students, middle schoolers, and anybody who's traveled here internationally, and certainly healthcare professionals. Keep going. Chickenpox, varicella, this is for adults. Again, women of childbearing age, this is particularly important. I won't really dwell on this, but this is usually 2 doses. Children are getting them. I know it's really painful to watch your child get 5 or 6 immunizations at one time, but as they say, they don't remember it, but I remember the first shot, the second shot, and the third shot. So if you have small children, grandchildren, please make sure that they get these. This is the chickenpox, or the varicella virus, is analogous to the shingles vaccine, the shingles that we develop as older adults. Keep going. Okay. There was the CDC, cdc.gov. You can look at this website and look at what you need to have. One of the things I didn't stress, and I really need to do this, is diphtheria, tetanus, and pertussis. Tdap is the vaccination that we ask for. If you get a tetanus shot, which keeps you from having lockjaw, you know, the one that you get in the emergency room when you get a cut, that's good. That keeps you from getting tetanus. But if you're a grandparent or you're in the care of children that are preschoolers, you need to get the Tdap, because pertussis, whooping cough, is something that has had a resurgence in the United States because many people are not being immunized against it. So for grandparents, anybody taking care of small children, please get a Tdap booster, which immunizes you against getting diphtheria, tetanus, and pertussis, which is whooping cough. Whooping cough is prevalent in the United States because many of our young children are not vaccinated against it, and many grandparents pass along this particular virus to their children. It's a respiratory virus. So grandparents, Tdap, that's what you need. Thank you.
Thank you, Dr. Parker. Just to clarify, do you need a shingles vaccine if you didn't have chickenpox as a child?
It's advised, you know, you may not want to take it, but you know, at our older adult ages, getting the varicella virus as an older adult can be incredibly debilitating for us. You know, when we were little, we could fight it off, but as you get older, your immune status changes, and what would have been an innocuous infection in somebody who was like less than 5 years old can be extremely debilitating for those of us who are over 65. So
Excellent. And there's a few more questions in the chat. We are going to keep moving because we still want to hear from
I'll answer
our
them.
next three speakers. Thank you. And welcome. Okay, welcome, Thrushi.
Yes.
Oh, I got it. All right, welcome. Okay, so you are going to share with us about Dr. Madeleine Hackney's trial that she has going on. You are her clinical coordinator. So quickly run us through what this phenomenal study is all about.
First of all, I'd like to thank you, Cornelia, and all of you for this opportunity. And yes, I'm the coordinator for this.
And you might need to turn your volume up on your computer as high as you can go and probably get as close to your speaker as you can.
Now?
A little closer, and if your volume can come up some.
I think this is it.
Okay.
Is this okay?
Oh, that's better. Yes. All right.
Okay. So yes, everyone, thank you for having me. I am the coordinator for the partner study. It is short for Partnered Rhythmic Rehabilitation for Enhanced Motor Cognition in Prodromal Alzheimer's Disease. The PI for the study is Dr. Madeleine Hackney. Next slide, please. To provide a brief overview, interventions that affect multiple factors rather than a single factor are more likely to be successful in preventing and treating Alzheimer's disease. Functional decline in Alzheimer's disease is severely impacted by impaired ability to integrate and modulate complex cognitive and motor abilities, in example, motor and cognitive integration. And through previous research by our PI, Dr. Madeleine Hackney, we found that combined motor and cognitive training has been recommended for prodromal Alzheimer's disease. Next slide, please. So our main intervention is PRR. It's a moderate intensity cognitive engaging social dance, involves varied stepping and rhythmic patterns, enhances social interactions effect on cognition. And the class structure is involving previously learned steps, a 20-minute warm-up, of partnering and rhythmic exercises done to music. Next step, please, or next slide. The central hypothesis is that PRR is safe, tolerable, and associated with improved motor and cognitive function, and brain and vascular and inflammatory biomarkers that might affect function. Next slide, please. So this is a single blind trial. We have a screening visit, which occurs 1 month before baseline, baseline visit, and we have a 3-month and a 12-month visit. Through the baseline, 3-month and 12-month, we have MRI scans, we have motor and cognitive assessments, vascular imaging, and blood work that is involved in each of those visits. And you can go next slide. First aim is to determine acceptability, safety, tolerability, and satisfaction with PRR and prodromal Alzheimer's disease. That's our first aim, and you can go to the next slide. Second aim is to determine efficacy of PRR versus walking for improving motor and cognitive integration in prodromal Alzheimer's disease, and to identify sensitive endpoints in other domains to power a future phase 3 trial. Our primary efficacy outcome is the 4-square step test that's collected at entry, 3 months and 12 months. Next slide, please. So our exploratory aims, we're looking at potential mechanisms by which PRR does affect prodromal Alzheimer's disease. We are involving our MRI scans, vascular inflammation measures, including arterial stiffness, cerebral perfusion, and inflammatory markers. So yes, like we talked about, the PRR intervention involves, it's a dance intervention involving interpreting motor goals through touch, connecting previously learned and novel steps, varied patterns, which enhances social interactions effect on cognition. And PRR stands for Partnered Rhythmic Rehabilitation. The walk intervention is a very engaging intervention. It's a group walking intervention. This will take place in small groups with research assistants and trained family members and or caregivers to control for social effects and contact of the intervention. It's expected, it's about a 10-minute warm-up, including 20 minutes of balance and stretching, calisthenics, and 55 minutes of walking with breaks as necessary. So we'll incorporate safe walking mechanics. Participants will lead the pace, and instructors will keep walking logs for each of the participants. And that is our study procedures for each of the stages. Like I mentioned, we have the screening visit, which is now done remotely, baseline, post-training, and post-maintenance. Randomization, recruitment, it's a blinding study, so investigators and staff, but not instructors, are blinded to the treatment. The participants will know the treatment, but will not know if it's experimental or controlled. As far as recruitment, it is a rolling enrollment study. We will use ADRC and CHH infrastructure at Emory, including clinical space, personnel, and laboratory facilities. And we're also we're attending a health fair actually in November and December, where we'll also recruit some more participants. Inclusion criteria. This is our basic inclusion criteria, which we are trying to recruit older adults who are 50 to 80 years old, who have amnestic mild cognitive impairment, subjective memory concerns, who have a MoCA between 18 and 25, a clinical dementia rating score of 0.5. That assessment is done by our neuropsychologist. We're looking for those who achieve less than 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity per week. And those who are not involved in any structured exercise program in the past 3 months and are willing to commit to a 1-year research program. This is a timeline of our study. It'll be over 5 years. We'll do the 12-month assessments, and then we'll conduct focus groups after that, and then analyze the aims 1 and 2, and then also submit the proposal for the phase 3 trial. So a little bit of the updates due to the COVID-19 pandemic. We are incorporating the remote screening visits. And e-consenting has been approved by the IRB. We've reduced the in-person visits to about 20% of all the intervention visits. So participants will attend about 1 out of every 5 classes. Dr. Hackney is also teaching us a tango training course being taught online to the team. And over the past couple of months, we have transitioned to administering our motor and cognitive assessments through telehealth. So we have the battery together and we're ready to administer. We've practiced with some of the participants so far. And we're also implementing a virtual walk program for our participants. So we're working on a weekly schedule where some of the team members can come in and teach our participants.
Okay, all right, so when are you all going to begin recruiting? think that's what some people want to know. I mean, this is like built in an exercise program,
Right,
but
right.
a research study.
So we're continuing with recruitment, as always. Like I said, we're attending some health fairs in the next couple of months. So we're always recruiting. When we do recruit people, we'll do a phone screening, and then soon after that, we can go ahead and do the CDR screening. And then once they're eligible, we can start having them come into our classes.
And was there an acronym for WALK?
Uh,
Okay, we might have lost Qureshi. But at any rate, so Dr. Madeleine Hackney, the PI for the slide, for the research study, will be on next week. And again, she'll be able to further clarify some of those questions that you have and talk more in depth about the rationale for the study. And it is a time commitment, but it looks like you will be getting some active engagement for your physical activity. So next up, we're going to be talking about just practical bathroom safety, how to reduce your fall risk right now, since we're at home more, and as older adults, we tend to, over time lose our balance, and mobility issues come into play. So that's why we have you exercise. But right now I want to welcome Maureen Burke, and give me a second. I'm going to pull up the correct slides here. Hi, Maureen, welcome.
Hi, how are you?
I'm well.
Thank you for having me.
Here we are. Let's see here. And I see, okay, Monica's still on. If you still, I see she's actively answering questions in the chat.
Okay.
All right, here we go. Come on, slides.
So perhaps before I begin the slideshow on bathroom safety, I just wanted to remind everyone about the Cognitive Empowerment Program's live sessions for the community. Cornelia has been sending out flyers, so many of you have probably seen them. But this month, in addition to exercise, yoga, and Tai Chi, we're adding 2 additional educational programs. One is the basics of MCI, and also MCI and driving. So we hope you can join us for any or all of those.
Okay, I am going to, I'm having a few issues, so it's not letting me advance, but go ahead, Maureen.
Okay, so there are a few things we know about falls. First, we know that women are more apt to fall than men. We also know, according to the CDC, that the leading cause of fatal and non-fatal injuries for those over the age of 65 is falling. We also know that we're twice as likely to be injured if the fall occurs in the bathroom. And that's the reason I thought it was especially important to zero in on bathroom safety today. And the other point is that we tend not to tell our doctors or our family about our falls. And I think we should change that. Next slide, please. So there are several reasons, as you may guess, why we fall. Of course, balance, strength, coordination, also pain in the back, the legs, different parts of the body. Sometimes impairments of the sensation on the bottom of the feet can be a factor. Dizziness can occur with some medications and supplements, so it is important to check with your doctor or healthcare provider about that. We know that poor footwear, age, low lighting, not a room that's bright enough, and also throw rugs are also factors of why we tend to fall. Next, please. So today I'd like to talk about just a few simple changes that you can do in your bathroom that will really have a big impact. No renovations involved. So first we'll look at a variety of shower chairs. We'll move on to types of grab bars, some modifications for your toilets, and then just some other accessories that can help with fall prevention. Next slide, please. So this is a typical shower chair. It's a plastic chair. It does have adjustable legs and non-slip feet. And so those are two things that you really want to look for. This is usually placed in the shower. Sometimes if a bathtub is large enough, you could put it in a tub as well. They come in padded varieties with armrests, but this is a nice, safe option. Next step. Now this particular one is called a tub bench, and it may not be the prettiest, but it really is my favorite. It has saved many of my clients from needing to renovate their entire bathroom. As you see, it's a longer bench. It extends to the outside of the tub, so there's no balancing on one foot. People who are on wheelchairs can easily access this. And so it's a matter of just sitting on the edge and scooting over. It's very safe. So again, the important things are making sure it has adjustable legs and also the non-slip base. People who have had frequent falls, have trouble with their balance when their eyes are closed, or a lot of pain, either in the back, the hip, the knee, or the ankle, may want to consider the tub bench as opposed to the chair. Next slide, please. And here are a variety of grab bars. The two in the center are the traditional hospital rehab center grab bars, but there are many others that are now on the market that are beautiful and can match any decor in your bathroom, like the one on the left and the one in the upper right. I also like this toilet paper holder, which just looks like a cute toilet paper holder, but it's actually a grab bar. And so the key with grab bars is the placement, to make sure that they're placed in the correct location and that they're stably placed into studs in the wall. Next slide, please. This is a fun, great option for just increased stability. It just fastens onto the side of the tub. It doesn't scratch your tub. It's very easy to install, and they're stable. I like these as another option. Next slide, please. And now on to toilets. The ADA height is 7 to 19 inches from the base to the bowl. That's the recommendation. And that's often what we see as comfort height toilets. But of course you need to personalize. So you may be 5 feet tall, so you don't need the additional height, but you may need the bars. The one on the right is the standard, what we call the 3-in-1 commode, which is often sent home with people from the hospital. That frame can be placed over the top of the toilet to add height, and also for the handles. It can be used as a bedside commode, and it can also be actually used in the shower. Next slide. Just some ideas for non-slipping. You do want to make sure that you have something inside of your shower or tub with the non-slip, either strips or flowers or the mat. But then don't forget, when you're stepping out, it's really great to have a mat with a non-slip surface so your wet foot doesn't slide away from you as you step out. And next slide. These are some other considerations. A handheld shower is nice to have. A shower caddy where you can access the items that you need very easily. In the center, we have long-handled sponges. And on the left, those are designed to clean in between the toes, can be also used for drying in between the toes, or with lotion application in between the toes. And that's usually a very important thought for diabetics. Next slide. So just some ideas for you to think about today. Consideration of the use of grab bars. Think about non-slip mats. Make sure the lighting is bright in your bathroom. The idea of a toilet seat or bar. And then the idea of whether you would maybe need a shower chair or a shower bench to make bathing much more enjoyable and safe. And next slide. And finally, what to do. So if you've heard some of this information, you're not sure what to do, where to go, what to buy, the best thing to do would be to ask your primary care doctor, NP or PA, for an occupational therapy home evaluation. The OT can come into your home and offer different suggestions on improving the entire safety of your home. They will help select the correct items, measure, help order, and then of course train you on the use of the equipment. For the installation of the grab bars, you would need to have a contractor for that. OTs are not doing that these days. So I thank you for your time.
Wow. Thank you. You packed so much in such a short amount of time. Do you know just so you can get the evaluation or referral from your primary care doctor? Do we know specifically what devices are available through your insurance, and what
Yes.
are things that you can just purchase off the shelf?
You can purchase actually all of these through Amazon. You'd be surprised, some of the larger stores like Home Depot and Lowe's also have some of these items in stock as far as the toilet seats in some grab bars. But the best thing to do is really buy online because they have the best variety. So that's what I would recommend.
Wow, yep. Some viewers are saying that was so helpful. So now if you want to participate, I just want to ask our viewers, how many of you have throw rugs in your bathroom? You can raise your hand or give me a thumbs up. Yeah, the infamous throw rug. A couple of years ago, I slipped on mine getting out of the bathroom, and I ended up hitting my shin and had a case of cellulitis. So again, this is so timely because we're at home more, we're spending more time in our bathrooms and even in our kitchens. So we may have you come back in a couple of weeks and tell us about how to outfit our kitchens, just because, again, with the stay-at-home orders, we should be at home, and we are home more, and you see us all Zooming from home. So these tips are not just applicable for older adults. I think it's key that we take heed to the information, and let's see what's here in the chat for you, Maureen. Okay, I'm in OT and care for my mother. I have one, but I move it when I take her in and out. I wonder, is that your tub bench or a chair? My mother has rugs in her kitchen and her living room and entryway. I tell her how dangerous they are, but she ignores me.
Yes.
They're nice to have, and they're great accent pieces, but if you don't need them, what would you tell us, Maureen?
Well, I have a mother like that too. So I think that if they will not remove them, then double-sided tape is an option. So the rugs are very secure and they don't flip up with the chair movement or something like that. So that can help secure the rug to the floor.
Okay, and do you recommend the stock on grab bar?
The stick grab bars, the suction cups, I cannot actually recommend those. They do have a lot of varieties, but they are not stable. The issue is particularly if they're applied to a tile surface or a surface that has any sort of texture to it, the suction doesn't hold well. I have seen them work relatively well with a very solid insert for a bathroom, but they need to be checked every time before they're used to ensure that they're stable. And it really should just be for a light touch, not for someone who needs to heavily rely on that with their full body weight.
Okay, and another viewer is saying we added tile floors in the bathroom. What recommendations for cold floors?
Wow, cold floors. There are heated floors. I know they do that a lot up in the Northeast, but since the tiles are already put in, probably footwear, resistive footwear would help. And then just remove that before entering into the shower tub.
Okay, and another viewer is saying we purchased a bath lift and toilet lift that works great for my mom.
Awesome, very good.
Okay, all right, well, Maureen's gonna be on a little bit longer if you have a few more questions for her. We're gonna close out with our healthy aging study. Whit, if you wanna join us and come on in. Thank you all, that was such a great presentation, and thank you to the 213 people that are still online with us. Whit, hello.
Hello.
Hi there.
How's it going? We've got some really awesome presentations today. And for those that are new, my name is Whit. I am the communication specialist for the Healthy Aging and the Healthy Brain Study. For those that have joined us here before, this might be a little familiar, but we want to spread the word about some really great research opportunities that we have. And one of the really cool things about the Emory Healthy Aging Study, hopefully you can see my screen here for those that haven't seen it before, is that this is actually an online initiative. And so unlike a lot of different types of research opportunities where you may go in and maybe they're testing a drug or they're wanting to do something as far as like taking samples and things like that, the cool thing about the Emory Healthy Aging Study is that it is all done online simply by completing an online health history questionnaire once a year. So we're looking to try and actually get 100,000 people is what we're going for to get involved with the Healthy Aging Study. Right now, we have more than 30,000 people that have actually registered and more than 16,000 people that have just gone through everything right away and completed their health history questionnaire. Now, we've talked a lot about this initiative in the past. One of the things that we've also touched on briefly was a really important sub-study of ours, and that is the Healthy Brain Study. And so one of the really interesting things that has transpired out of this COVID-19 quarantine is our usage of technology and the role that it has played in our research efforts. And so that's actually one of the things that I'd like to highlight today, because we've had a lot of folks that have started to get involved with the Healthy Aging Study, but we're starting to get some questions about our Alzheimer's focused sub-study, the Healthy Brain Study. Now, while we do have participants come into our clinic, research clinic, once every 2 years to complete various tests, to do some sample collections, we do some MRIs. One of the things that has actually changed is now we are able to conduct a decent part of the research visit virtually. And so what does that mean exactly? What are we doing there? And what the virtual visit has allowed us to do is to take certain types of tests, like our cognitive testing, for example, and updating our health history questionnaires, as well as, going through any of the consenting process. We can do that now without you ever having to leave your home. And that really makes the follow-up research visits when you come in for the sample collection far shorter. So much shorter, actually, that we break it down into just two-hour visits. Rewind a couple of years ago, it was actually about an 8-hour visit, all in one day that we were trying to do all of this. And so what we've been able to do now with the technology is really make it a whole lot easier for our participants to get involved and to participate in this really interesting research study. Now, the thing about the Healthy Brain Study that I do want to mention there is that this is not a drug trial. This is not an interventional study. This is a longitudinal study, meaning that we are tracking our participants and we're working with healthy participants, those who do not have an MCI or an Alzheimer's or dementia diagnosis already. And we're following them every 2 years. And we're looking for the biomarkers in our bodies that are going to really help us understand and predict who's going to develop Alzheimer's disease or dementia. And so one of the things that we're trying to really push here is how can we make this easier for our participants to be able to get involved with it? And I know we've had some folks that are a little apprehensive about doing a virtual visit, and we've actually worked to change that a little bit, because we now have one of our recruiters, Laterica, who unfortunately wasn't able to join us here today. She will actually go through the Zoom technology meeting, is what we call it, and actually get you prepared to go through a virtual visit. So by the time, if you actually become a participant, by the time it's ready for you to go and do your virtual study visit with us, we will have already walked through all of the process with you. We'll make sure that your technology is up to date, make sure it's updated and ready to go, and that you're comfortable using it, so that we can do this in a very controlled environment and make it very easy for you as well. And so on our website here, this is one of the things that I just want to kind of showcase the differences between the Healthy Aging and the Healthy Brain, is that our aging study is kind of our overall umbrella study, and that's where we're asking folks to complete their online health history questionnaire. And you can do that simply by going to our website up here, and I'll drop this in the chat box as well. But there's this big yellow button that says join the study. And when you click on that button, it's going to start the walkthrough process where you'll actually register, consent, provide contact information, and then finally complete your health history questionnaire. It takes most people about 30 minutes to do. And again, if you've got 30 minutes once a year in free time, you can actually help us with research. But for those that maybe want to go a little bit further, after you've joined the Healthy Aging Study, if you qualify, what we will do is we will actually contact you about the Healthy Brain Study. And that's where you'll see here the Emory Healthy Brain Study page, where we talk about all the different types of things involved with it, the steps on how to get involved, what the research study entails. Down here at the bottom, we have a really cool video bank of different types of videos that cover the tests and sample collections that we're doing. And then we've also got some participant testimonials, folks that have gone through this in the past that were pretty apprehensive about certain elements of the study and then actually turn out to have a really positive experience and were willing to work with us and provide feedback for future participants. And those are the highlights that I wanted to cover today. Like I said, I am going to drop my contact information into the chat box here for everybody. And I'm also going to put our recruiter Laterica's email in here for you in case you have any questions or you want to just reach directly to her about participating in the brain study. You can do that. As always, though, if you've got my contact, I encourage anybody to just send me an email directly, and I'll be happy to provide you with additional information or answer any questions about the study that you may have.
Really quickly, tell us the inclusion criteria for Healthy Brain.
So Healthy Brain, I can't go through all of it because it is a little bit of a longer list, but the base things for inclusion criteria for that are going to be, we're looking for folks that are between the ages of 50 and 75 years old. We are looking for healthy individuals. So for example, if you have an MCI diagnosis or you do have a diagnosis of Alzheimer's or dementia, that would exclude you from the study. Also, if you are on, for example, like a blood thinner, that would be something that would probably exclude you simply because we do a lumbar puncture as part of participation, and we want to make sure that everything's done in a very safe environment, and so that's something that may interfere with us being able to perform that procedure.
All right, so Dr. Parker, will you come back on, and Maureen and any of our speakers are seeing a couple more comments in the chat. This concludes like our formal presentations for today, but we will continue to answer questions. One question for you, Maureen, was what about vinyl luxury planks?
About what? Let's see. Vinyl.
It's in the chat, and
Let's take a look and see.
Flooring. It's flooring for the bathroom.
Oh, the types of flooring for the bathroom. Vinyl planks are okay. As long as the person isn't walking without footwear, you know, I mean, that's the key, is to have a non-slip type shoe. Some folks like to use water shoes, that you just plastic shoes that you slip on. You can actually use those while in the shower as kind of an alternative to a mat, because that will provide the non-slip, you know, on the shower floor as well as the bathroom floor.
It's a great addition.
Mm-hmm. All right, you heard a lot of information today. We're going to close out with a few announcements, and just be mindful that the presentation was being recorded. We're going to send out a PDF. You can always visit our website if you want to see past episodes and access some of the PowerPoints. It's www.alzheimers.emory.edu. And if you go to the What's New tab at the top of the page, that will take you to where we kind of been archiving all of the PDFs. And then if you go to the YouTube channel, you'll see all of the video links. So Dr. Parker, tell them what we have in store for the end of October.
So as many of you who've been with us for quite some time are aware, we have two really large, big brain health forums in the fall and in the spring. So due to pandemic, we have to have a virtual forum this year. And the speakers that we're going to bring in on October 27th, there's your flyer. Our Brain Talk Live is going to be the annual Brain Health Forum or the Fall Forum. And it's going to be from 1 o'clock p.m. to 3 o'clock p.m. That's 2 hours. So instead of 1 hour, an hour and 15 minutes, it's going to be 2 hours. Our special guest will be Dr. James Galvin, who's going to talk about Lewy body dementia. He's from Florida Atlantic University in Miami. And Dr. Robert Stern, who's going to talk about chronic traumatic encephalopathy or head trauma and brain dysfunction. Dr. Karima Benamer, who's an who is an Emory neurology hospitalist, who's going to be here to talk about stroke and related vascular dementias. So we really do want you to come. So we have faculty from Boston University, from Florida Atlantic University, our own Emory University. We'd like you to come. Just like you heard from Dr. Risa Sperling from Harvard last week, we've got some international subject matter experts, that's what I'll call them, doctors and researchers who are treating and studying the origins of brain dysfunction, otherwise known as dementia. So please join us on Tuesday, October 27th to hear from Dr. Robert Stern, Dr. James Galvin, Dr. James Law, who all of you are familiar with if you've been with us a lot. He loves you, and just as you love him, we want you to hear from him, and Dr. Karima Benamer, our hospitalist, to talk about the different types of dementia, specifically chronic traumatic encephalopathy, frontotemporal dementia, Lewy body dementia, and vascular dementia.
All right, and the rest of you, if you can put your contact information in the chat if people want to get additional information about Dr. Madeleine Hackney's upcoming study. And then there are several links in the chat. That first link is to the CEP Live program. That's their unstructured program that they're hosting every week virtually. You need to register. This is an ideal time as we're closing out this session of Brain Talk Live that you can go on and click that link and register. It is a recurring weekly session. So once you register, you're registered for good. It's every Wednesday, I believe. And Maureen, I don't know if you want to do one last pitch. Also, the registration for the 19th forum, it will be a different registration link. So even though we will be using the Zoom platform, I haven't created the registration link, but be looking out for that link. And then naturally, the healthy aging link is there as well. And if you want to follow us on Facebook, we post a lot of this content there as well. So Maureen, any final thoughts about the CEP program?
Oh, I would just really encourage, if at all possible, to try to join the exercise program, yoga and or Tai Chi. We know there's a lot of research on Tai Chi and the reducing of risk of falling. It really helps the balance in older adults and middle-aged adults. So I would really recommend it for the fall prevention. And then I think it's great, the new 2 segments, which are the basics of MCI and also MCI in driving. So they both will be very informative. So I encourage you to take a look if you have the time.
Excellent. Okay, well, we are going to hang out a little bit longer. If you want to participate in the poll, again, we thank you. If this is your first time joining us, meet us back here next Tuesday at 2 p.m. Eastern Time and invite others. If you have found this beneficial or helpful, invite others. Word of mouth is our best marketing tool. If you tell others and share the link. We've posted so many links today. And someone just said, where's the information about the exercise? So Crystal or Natalie, if you guys will repost the CEP link. It is case sensitive. So that's why you see the capital CEP. It's case sensitive. So you'll need to enter it or just copy and paste that exact link into your any browser and register. Okay, a few more questions coming in. Okay. Maureen, are you still on? Why do women fall more often than men? And why are people, why do people have reservations about telling their doctor?
Well, I don't know the reason for actually the women. It wasn't clearly defined as to why women more than men. I don't know if it's because women are more likely to tell their doctors, or if women, because they traditionally have a longer lifespan. I'm not sure how that measurement it took place. But I think it's the embarrassment of falling is the reason why people don't want to tell their loved ones about it, because they somehow feel like they're getting old, or they won't be able to stay in their home and that kind of thing. But it's just the opposite. Being open about it can help, have an OT, PT come into the house, and to really help get the house in a safe position to reduce the falls. We know that the interventions will reduce falls. So it's okay to fall, but once you start having multiple falls, we know that you will get injured, and we know that the bathroom falls can be very dangerous. So.
And let's see. Okay.
I was going to, oh, excuse me. I was going to put down the CEP program link, if that would be helpful.
Mm-hmm.
Okay, so I'll finish getting that typed in here. Let's see.
And I don't want to distract. Maureen, someone just posted it.
Oh, they did? Oh, perfect.
Yes.
Okay, great.
I know, but I wanted to ask you, so do you know by heart the lineup?
Well, I can tell you, yeah.
Schedule?
So
yeah, great.
Mm-hmm. So on Wednesday, from 10 to 10:45, there's a workout with Ayatoni. And so that's physical exercise. So he'll be doing, he does different themes, but it's a general workout for the whole body. And then at noon on Wednesday, it's yoga with Megan. And that's also a class from 12 to 12:45. And you may either stand or sit in yoga. If standing is difficult, that's not a problem. Megan is very flexible and has the program set up for all different levels, as does Ayatoni. So you don't have to be, full of energy and ready to go to the Y and exercise. It's okay if you're just sitting in your chair in your living room. You're still very appropriate, for these classes. And then the third one is Tai Chi with Tina, and that's also on Wednesdays. And Tina will see you between 1:30 and 2:15. The Tai Chi is a standing type of exercise. It's very slow movements, very slow coordinated movements. And then, of course, the special sessions in October, those are on October 14th. And that date, I know I'm giving you a lot of dates and times, but we'll hopefully be able to get this posted for you. So the special sessions in October 14th, is the overview of mild cognitive impairment. And that's from 2:30 to 3:15 in the afternoon. And then the following week on the 21st, the presentation will be on driving with mild cognitive impairment. And that also is held at the same time from 2:30 to 3:15. So I hope that is helpful. And they're really great programs, and yeah.
Another question, are the sessions recorded if people want to go back and view them?
I am not sure. Usually they are, but I would have to find out some more information on that.
Okay. Well, once we know, we can let viewers know. Yeah. And I think that's all we have. If you all, let's see, I want everyone to write this number down. If you're interested in CEP, it's 404-712-5555. Write that number down. Quickly give them a call, and if no one answers, just leave a voicemail. Someone will get back to you. They can give you the meeting ID number.
Mm-hmm.
If there's a passcode, there's probably someone that can just actually register you if you don't want to go through all the hoops of clicking the link and entering your information. We want to make it as seamless as possible because
Right.
You know, we're in a virtual environment, so we have to do we have to, you know, rely on technology and this digital environment to get us through. So I think the easiest thing would be to just call a number. It's 404-712-5555. That's an easy number to remember. And so that'll be your homework. Go ahead and sign up for CEP. Make sure you share that information with others. Participate in the poll as we wrap up today. Again, thank you for joining us, and we will see you back here on Tuesday. Oh, and one more thing. For the first week in November, I think we will go and have another, we'll have a break from our formal presentations, and we're going to do probably trivia. I think that's election day, so I hope we'll probably be out voting or have already voted, but if you have time during that day, we're going to play trivia. We're just going to keep things light and fun, and we're probably going to have a little dance party. You know, John came on, and instead of him doing like 8 minutes, he did like 15 minutes, and we may have him teach us like the cha-cha slide or something. But that day is just, we're going to have fun, let our hair down, do some music, trivia, or if you have any other thoughts. But we'll have our Tuesday sessions all through October, with the exception of October 27th. We're going to have different time slot and a more comprehensive program that Dr. Parker just mentioned. And then that first Tuesday in November, we're just going to have some fun. We're going to laugh. We're going to quiz each other. And then if you played in the trivia session in September, the tumblers are going out this week. Our mailer is, they're a small shop, and they had a lot of jobs that took priority over getting the tumblers out. So I do apologize for that delay, but at any rate, those tumblers are coming. So again, if you want to participate the first Tuesday in November, just be prepared to sign up. And we're going to have fun on election day, but it's just going to be our Zoom party day. Okay. All right. Well, with that, thank you guys for being here, and we'll see you next week.